Hello, I'm Dr. Amreen Singh, Infertility and IVF Specialist. Today we will talk about cryopreservation. Cryopreservation is a procedure where we freeze the gametes of the male or a female. So it can be eggs, embryos, and in males it can be sperms. So the cryopreservation is of two types. It can be a social cryopreservation when there is a female or a male who wants to delay their pregnancy or they want to delay the time when they want to conceive. And the other type is the medical type. In medical type, the person who is undergoing a cancer treatment, a chemotherapy, radiotherapy or a surgery, it is advised to those patients to preserve their gametes. And then in the patients who have high risk of having premature menopause or premature ovarian failure. And also in some patients like severe endometriosis, cryopreservation is advised to these patients. And there are many other conditions in which cryopreservation is advised. And now let's talk about how the cryopreservation is done. So you must be wondering at what age you can cryopreserve your gametes. So according to Indian law, females can cryopreserve their gametes from the age of 23 to 50 years of age, and in males it is from 23 years to 55 years. But if you are doing a social cryopreservation or if you are doing a medical cryopreservation, the age limits vary, because in social cryopreservation we always advise you to do your egg freezing or the embryo freezing before the age of 35 years, because that gives us good quality of eggs or good quality of embryos. And in medical cryopreservation, if the person is going through a cancer treatment and her age is only 21 or 22 years, or a male is going through a cancer treatment, that person can definitely do the cryopreservation of the eggs or the sperms. Now coming to the methods of the cryopreservation. In females, the cryopreservation is done after giving few hormonal injections to the female, and then the eggs are retrieved from the ovary. And if the female is married, then the sperms are fertilized with the eggs and the embryos are frozen. And if female is unmarried and if she is doing social cryopreservation, then only the eggs are cryopreserved. In males, the cryopreservation is done by collecting the semen sample which is produced by a male by doing a masturbation. And in cases where there is no sperm in the semen, the other procedures like TISA or micro-TISA can be done. In this, in TISA and micro-TISA, the sperms are retrieved from the testes and they are frozen. And then these frozen gametes, sperms or eggs can be used in future for making embryos and for the purpose of conception. And now coming to for how long you can keep your gametes frozen. So according to Indian law, we can freeze your gametes for 10 years, but if someone wants to cryopreserve their gametes for longer time, then they have to take a special permission from the ART board. So if we talk about the social cryopreservation, which is done by the females or the males when they want to delay their pregnancy or the conception, then the common question being asked is, what is the best age group to preserve? So in females, the best age group to preserve their eggs are between 25 to 35 years of age. Because you have to understand one thing, that with age, with the increasing age, the quality of your eggs decreases. So when we freeze those eggs and we in future when we make embryos out of that, the embryos formed from that gives us lesser pregnancy success rate. But if you have cryopreserved your eggs in a younger age group, that will give you a better success rate. So this is all about the cryopreservation. If you have more questions, so please write to us. Thank you so much.